Hi, I'm Jacqueline Jackson, Chiropodist at the Leamington and Area Family Health Team. In this video, I'm going to discuss fungal infections of the feet, the types, how they are transmitted, risk factors, signs, diagnosis, treatment, and prevention. Fungal infections of the skin and nails of the feet are very common, and the incidence of certain types is increasing. It is largely a disease of adults, but children may also be affected. What are the functions of the skin? The skin constitutes approximately 1/6 of total body weight, and it has 4 major functions. It protects the body against harmful light rays, mechanical, chemical, and thermal insults, dehydration, and invasion by harmful microorganisms. It is the largest sensory organ in the body. It provides insulation against excessive heat gain by evaporation of sweat from its surface, and also insulates against heat loss. Vitamin D is also manufactured by its most superficial layer. What is fungal infection of the feet? Fungal infection of the feet is a disease of the skin and/or nails caused by plant-like parasitic organisms whose diet is keratin, which is a protein found in skin and nails. These organisms live in the most superficial layer of the skin and nails. As they multiply and grow, they produce enzymes, toxins, and antigens which degrade the skin and nail structure, and may also produce an allergic reaction. What are the types of fungal infection? The 2 types of fungal infection of the feet are tinea pedis and tinea unguium, also known as onychomycosis. Tinea pedis is a skin infection frequently seen between the toes and on the sole and borders of the feet, and is commonly known as athlete's foot. Tinea unguium or onychomycosis is a fungal infection of the nails. How is it transmitted? A fungal infection of the foot is usually acquired from an infected person, either direct or indirect contact, although a rarer type is spread by infected cats and dogs. Generally, one is at risk of acquiring infection wherever one goes barefoot, especially in public places or elsewhere. What are the signs? White, dead skin with cracks and itchiness in the toe webs, or dry scaling, sometimes with itchiness on the sole or borders of the foot, are often the first signs of athlete's foot. If untreated, these signs and symptoms could progress to pain, oozing, and odor between the toes, or to blisters and pustules with redness and swelling on the soles and borders. These signs do not always mean fungal infection, because other conditions may be responsible, such as contact dermatitis, which is an allergic reaction, psoriasis, dry skin, sweaty feet, bacterial infection of the toe webs, and physical damage to the nail plate. The earliest signs of fungal infection of the nails is usually a brownish, yellowish discoloration of the side or end, which may be accompanied by thickening and loosening of the nail. This may spread to involve the whole nail, which then exhibits splitting, over curvature, a crumbly, worm-eaten appearance. Diagnosis. The usual way to definitively determine the presence of fungal infection of the foot is by microscopic examination of small pieces of skin scales or nail after assessing the clinical appearance. The specimens are collected and sent to a medical laboratory where culture studies are done. The presence of a fungus is confirmed and the infecting organism is identified. Treatment. There has been good results achieved by patients if the fungal infection is detected in an early stage. Fungal infections generally are considered to be recurrent, and treatment is directed for the most part towards alleviation of symptoms like itching and cracking skin and the prevention of spreading locally or to more distant parts of the body by topical and/or systemic antifungal medications. In deciding on a line of treatment, the healthcare practitioner will take into account the severity of the infection, the type of infection, the person's age, and general health. How can you protect against fungal infection? While several factors unique to modern life have resulted in an increased prevalence of fungal infections, as well as such risk factors as previous nail injury, skin infections, family history, poor circulation, smoking, and specific medical conditions, infections of this nature are preventable by following these tips. Keep feet clean and dry, with special attention between the toes. Avoid nail polish and acrylic nails. Wear clean socks every day. Use a small amount of bleach in the washer to kill fungal spores. Avoid walking barefoot in public showers, pools, and locker rooms. Keep nails clipped short and straight across. Wear well-fitting shoes made of breathable material and disinfect them regularly by spraying with Lysol. And disinfect clippers and other instruments used to treat your nails and feet. If you experience any symptoms of a fungal infection in your feet, please contact your health practitioner, dermatologist, or chiropodist. Thank you for watching. For more tips on how to take care of your feet, please check back for more videos. See you next time.